Now, I'd like to highlight and introduce to you our guest speaker tonight. It is Beth Whelan. She is an epidemiologist with the CDC, and her topic tonight is about, well, you know what? I'm just going to have her introduce it. Beth, take it away.
Okay, so let me share my screen, and maybe someone can let me know if it's working. Hold on a second.
Got it.
Can you guys see it okay? All right, let me get rid of you guys. Sorry. Okay, and then full screen. Okay, how's that?
That's good.
Okay, great. So thanks everybody. And really, I appreciate the invitation to speak tonight about my experience working at the CDC, especially during the pandemic. And of course, as a scientist, it's hard for me to talk about work without sharing slides. So I do have some slides, but it's only about 10 minutes or so, and then we can leave the rest of the time for questions and discussion. So here we are, and every day when we're at the Incident Command Center in the at the CDC, we talk about the numbers. And so in the US right now, we have recorded over 30 million cases of COVID-19. Yesterday, the number of cases was nearly 70,000. And a total of 546,931 of our friends, family, colleagues, neighbors, coworkers, others have died from this disease. So that's over 500,000 souls who have lost their lives to a preventable disease. And that's not even reflecting on the global impact, which is just absolutely staggering. So we all know that the basic actions to prevent COVID-19 transmission in any public place include social distancing and wearing masks. For some employers, enabling maximum telework is the most effective method of promoting social distancing. And many of us have been fortunate to be able to work from home and still earn our salary. And I had to laugh when I saw Meredith's advertisement for this talk.
Hey, I'm sorry, Beth. I'm just going to give a general reminder to please mute everyone. If until the discussion, please mute yourself.
Very good job. And so this is the allegations are about to start.
There we go. Can you guys hear me okay? Okay, so anyway, I had to laugh when I saw Meredith's advertisement for the talk, which was this like an image of an exhausted woman with a glass of wine, because that was sort of, it's been me for the past year. But this work at home scenario is not possible for most workers who are deemed essential. So who are considered essential workers? CDC follows the definition used by this organization called the Cybersecurity and Infrastructure Security Agency, or CISA. So that's what I'm showing here on this slide. This is a graphic of who are considered essential workers. And you can see that it includes key components of our country's infrastructure, such as communications, manufacturing, defense, food, and agriculture. So getting more specific, these graphics illustrate some categories of essential workers who have had to continue working in place while the pandemic unfolded. There are grocery and retail workers who've helped us put food on our tables and buy essential supplies like hand sanitizer and toilet paper. And meat processing facilities, which became the largest epicenters of the disease, in part because they were declared a critical infrastructure industry in April 2020, and they had to remain open. These plants have a high density of workers, prolonged close contact of personnel on the production line, indoor work environments with compact cafeteria and locker room areas, and a workforce with diverse cultural and linguistic backgrounds that make educational efforts more challenging. And then we had warehousing companies such as Amazon, or garbage and trash removal services, transportation workers such as bus drivers. Those were all the workers that were still having to go to work every day to basically serve the essential functions of the country. And remember, in the early weeks of the pandemic, we didn't know how critical at that point wearing masks was in reducing the spread of the virus. So there was a lot of time when these workers were being exposed. We didn't really know. And there were workers on the job during that time where thousands lost their lives to the disease. So why do most of us in occupational health consider COVID-19 to be an occupational disease? So there are many factors, and they include workplace characteristics such as the lack of personal protective equipment or PPE, and the inability to be physically distant from another worker at work. And then there's individual factors such as demographic characteristics and cross-cutting factors such as housing, transportation, and access to sick leave, childcare, and healthcare. So when thinking about factors like housing and transportation, consider, for example, the population of migrant farm workers who often live and work in the same location in congregate living accommodations, and they use shared transportation. In the early months of the pandemic, we had phone calls with large growers. So one of them was Red Gold. You might know about that company, Red Gold tomatoes, for example. So they were about to hire, this was in the early spring, just about exactly a year ago. And they were about to hire migrant workers to pick the crops that would go into the canned fruits and vegetables that we consume all year long. So one company we spoke with said the work that was done in that time period of early spring represents 90% of the food supply that needed to be picked in 60 days. So this is what we were facing. So this is a busy, but I really love this infographic. It's really informative. And so what it's doing, I'll kind of walk you through it a little bit. It uses data from a database called the Occupational Information Network to determine which occupations face the highest risk of exposure to COVID-19. And then the risk is graphed by according to income. So the risk score for each occupation is based on 3 physical job attributes. The first is how much does the job require the worker to be in contact with others in order to perform it? The second is to what extent does the job require the worker to perform tasks in close physical proximity to others? And third, how often does the job require exposure to hazardous conditions? So in this case, that would be exposure to the virus. So the green bubbles are the healthcare related occupations, and the blue bubbles are the non-healthcare jobs. And the size of the bubble represents the number of workers. So you can see that the jobs with the lowest income and the highest risk, so the lower right part of the graph, are those in healthcare support occupations such as home health aides and nursing assistants. These are the workers who are disproportionately affected by COVID and the ones that we worry about the most. Also, you'll note in the middle of the graph, you'll see 3 bubbles for teachers that are at different points on the risk continuum, depending on the grade level. So I know there's a lot to look at in this graph, and it might be something you want to take another look at when this talk is available on YouTube. But it does bring to mind one of our UU principles, which is justice, equity, and compassion in human relations. And looking at this graph, there's a lot of inequity here. So many of us in the field of occupational health consider work as a social determinant of health, just as economic stability, education, healthcare, et cetera, are social determinants of health. Work affects the physical and psychological aspects of well-being through the conditions and risks we face at work, as well as the influence that work has over other resources, such as access to healthcare, financial resources, and social connectedness. In particular, I want to point out that we have seen in this pandemic the effect on workers' mental health as much as the effect on physical health. So imagine a healthcare worker, say a nurse in the ICU treating COVID-19 patients, working long hours, not having sufficient access to personal protective equipment like face masks, having to reuse their face masks over and over, and wondering if they're going to become infected, and if they do, will they then infect their families? Similar concerns for grocery store workers and other frontline workers. So the stress is illustrated by some of the vivid headlines that we saw over the past year. The pandemic has disproportionately affected minority and disadvantaged populations, and layered on this are the physical and psychosocial stresses that essential workers have experienced on the job. So it was interesting that I wanted to let you know we have a research team that is conducting a rapid review of the science at the same time that we're responding to COVID-19. And we realized after seeing so many of these media reports and headlines that we needed to capture the issue of occupational violence as part of our team's work. And I'm sure you've seen the reports of violence across the country when workers try to enforce mask wearing and social distancing at work. So, and again, it brings to mind that UU principle, justice, equity, and compassion in human relations. So what have we been doing to address COVID-19 in the workplace? One thing we do is provide worker support in the form of guidance, fact sheets, and tools for workers and employers. I know you can't read these fact sheets, they're tiny, but just to give you an example. We design these specifically to occupational groups where it's warranted, for example, manufacturing and transportation and meatpacking. And another thing we do relates to our program on occupational health equity. Occupational health inequities are avoidable differences in workplace-related fatalities, illnesses, and injuries. And we know that essential workers are disproportionately represented in communities that have been historically underserved by public health institutions. This is manifested in overrepresentation in hazardous jobs of individuals that are economically and socially marginalized. These workers may receive different treatment on the job, and they may receive limited access to protective resources, such as personal protective equipment. And then finally, this is actually my last slide, and then we can have some discussion. I just wanted to show you some examples of the studies that we have in progress now that are attempting to address worker health inequity during the pandemic. So one is looking at meatpacking workers and mental health. We hope this project will help us better understand the relationship between workplace experiences, social inequities, and mental health and well-being during the pandemic. Findings will inform communication products as well as future research and public health response efforts. A second study is using a community-based participation approach to look at seafood processors. This worker population is extremely diverse. It may consist of low-wage seasonal workers who are frequently migrants, immigrants, refugees, and racial and ethnic minorities. Social and economic factors such as language barriers and incentives to work while ill may also contribute to increased risks. We'll explore what workers feel can be done to improve the safety and health at their own work sites and knowledges, attitudes, and practices around vaccinations. And a third project is looking at aims to explore racial and age disparities and social inequities in relation to impacts on the health and well-being of grocery and retail food store workers. These workers earn low wages, and many of them lack benefits like health insurance, hazard pay, and paid sick leave. So to wrap up, I think this pandemic has brought to the forefront staggering inequities, and certainly many related to health. Just one recent report that you may have seen finds that the pandemic has shortened the overall life expectancy in the US by over 1 year, by 2.7 years for Black individuals and 1.9 years for Hispanic individuals. Every day of life is precious and every soul lost is tragic. And even more tragic is that these were all preventable deaths. And it calls to mind another one of our principles, the inherent worth and dignity of every person. So I'll stop there and take any questions you have.
So Beth, there you go. So Martha Walker will be helping to call on people for questioning. So if you have a question, raise your virtual or your physical hand, or you could put a question into the chat box and I'll be reading those off.
Meredith, can you make it possible for me to see people? I only see myself.
I will take you off of the spotlight and that should help.
Thank you. Thanks.
You should be able to change it to gallery view now.
Yes, I got it. Thank you.
Jane, I see your hand.
Yes, I just wanted to comment. I work 2 days a week at the health department and as a health inspector. And I've really felt for my my compatriots because we were considered essential. They were wanting us to go out to various establishments and see that they were following these practices to try to get people to wear masks, and people are very confrontational about that. We're still getting, somebody's not wearing a mask kind of complaints and things. And it was just really challenging, and being with a workforce that I knew how fearful they are and have been. And I just wanted to comment on it.
It's a really interesting, this is, who knew, right, that we would have to worry about occupational violence in the middle of this pandemic.
Yep.
But you're absolutely right. We've all seen the headlines, and it's scary because they can't just say, well, I'm not going to go to work today. They have to be there, and they have to deal with it. And it's the mental health with this pandemic is something I think we're going to see a long, long time from now.
And then, we have to get into nursing homes and inspect, and it just,
Right.
it was not only the violence, but just the personal, the fear for your own health. And stuff.
Right. Mm-hmm.
Yeah.
Beth,
Just one other point I just wanted to ask you. Did you read, I guess, the last day or two when they have the conference of various top CDC folks talking about the evolution of COVID in the United States, what did and did not go right?
Mm. There's a lot to say there. Yeah. None of which I can say. No, I'm only kidding.
Nick, I see your hand. I'm going to go ahead and ask a question in the chat first, and then we'll move to you. So, Beth, a question in the chat asks, what type of changes have you seen with the new director?
Oh, yeah. Great question. Well, she's only been in place for exactly 60 days, right? A little bit over, January 20th. She's fantastic. Her name is Dr. Rochelle Walensky. She's an top infectious disease specialist from Massachusetts. One thing we've had 2 meetings with her as sort of staff meetings. And one thing most recently, just this week, actually, she said something very gratifying, which was that I think the way she said it was, health equity will be at the center of everything we do now. And that is something we haven't really heard. So I expect, we hope to get her up to speed with respect to occupational health, because she does not come from an occupational health background, but she's from the right background for CDC. So we have very high hopes that things will start to shift at our agency anyway, with her in place.
Thank you. Nick?
Yes, Beth, I imagine that your folks work with the CDC.
I already got it.
I'm sorry, Nick, what'd you say? I couldn't hear you very well.
I hope that the CDC and Beth's folks work closely all the time.
You hope that CDC works with who?
The NIOSH.
Oh, well, right. I didn't go into that, but there's CDC. You guys know probably CDC is based in Atlanta, Centers for Disease Control. NIOSH is where we are here in Cincinnati. We are one of the centers, and it's a really good question, Nick. We sometimes work well with our mothership, and sometimes not as well. It's hard to sometimes get occupational health on the radar, which is kind of why I agreed to do this talk, because I really think the more people that hear about the importance of occupational health, the better. But yeah, we're constantly trying to interact with our counterparts in Atlanta to educate them about the importance of worker safety and health. Yeah.
And conversely, what you find affects their models for what projections.
Yeah. Modeling is really big, as you can imagine, in this pandemic. So there's a lot of modeling going on. Not as much as we would like to see with projections about the workforce. I think that we could do more with that. We certainly have the modelers that could do it. I know that's something you're interested in.
Mm-hmm.
Martha.
Oh, I just wanted to thank Beth for your talk. And a comment is that I think it was late summer, midsummer of 2020, there was all of the editors of the New England Journal of Medicine wrote an article in which they really were blatantly upset and angry about how the pandemic had been handled in the United States. And it seemed to me they were pointing fingers at the president. And I just wondered if you might want to comment on that article, Beth. Or...
I agree with that article. Yeah.
Yeah. It had a lot of details in it. It was very well written and explicit.
It's been very hard. I have to be honest with you guys. It's been very hard to work at CDC until recently.
Yeah.
Beth, we have a number of questions and comments in the chat here. The first one is, can you tell us more about the specifics of your daily work?
Sure. So let's see. So when we're not dealing with a pandemic, I have a job leading a branch that does research. It's called the Field Research Branch. And I have about 45 people in my branch, and they're epidemiologists like myself and industrial hygienists. And we do in-depth, deep dive studies of occupational health problems from everything from, we have a big program looking at firefighters. We look at reproductive health and nurses. In the pandemic, everything came to a grinding halt that was not COVID related. So it was kind of an all hands on deck response, and everything was virtual too, which was very strange, right? But it was quite effective. So I was technically deployed for the month of April 2020, a year ago almost. And I was here the whole time, but I was working 24/7 pretty much on the response itself. So I was actually at that tough time period when all the things were going on with the meat packing that I was telling you about, and the guidance documents we were writing, and I was reviewing those, and some of them were going up to the White House and some of them were coming back, and it was challenging. So after April, I basically, the rest of the year of 2020 was like a 50% working on the response and 50% or really 100% doing my regular job. So it was like 150%. So I was managing a branch and then working on response related. This research team that I referred to is really what I've been doing. So it's actually quite cool. It's the first time that we've stood up a research program, scientific literature research program alongside a response. First time we've done that. So I don't know if that helps day to day. It's hard to describe. I'm just sitting here where I am right now all day long.
And then you have that glass of wine.
Yeah, it's a little off camera now, but no, yeah.
How should new workplace rules enforced by NIOSH be informed by our COVID experience?
So NIOSH doesn't do enforcement. We do research. So OSHA is the one that does enforcement. So that's our sister agency. And to that point, it turns out that OSHA is actually implementing what's called an emergency temporary standard, which is amazing. That's the other thing that looks really good right now, is OSHA is much stronger than it ever has been. So they are working. We should see that coming out. It's called an emergency temporary standard. It's done very quickly in the scheme of government time. And we were able to see it. We were able to comment on it. We were able to add a lot of the research that I just referred to, that we had pulled together from what we've seen coming out of the response, to add to that. So it will protect workers. So things like barriers in workplaces, enforcing masking so that the workers don't have to do it themselves. They'll, signage and so forth. PPE availability, you probably heard early in the response, that was an enormous issue. There are plenty of N95 masks now. So lots of discussion about, who should wear an N95 and who should wear a regular face mask and all of that. But the protections that will be in place because of this standard by OSHA will be huge. It will be huge. So
that's good to know. I look forward to hearing what those are. Another question here. I have heard that there are numerous cases of Ebola in Washington State. Is this something to be concerned about?
So yeah, I'm keeping an eye on the Ebola too. So some of you might remember that I was in West Africa for Ebola in 2014. But we have a vaccine now for Ebola. So we're not quite as freaked out as we would be if we didn't have a vaccine for Ebola. So it's something that we're keeping an eye on, and it's always a worry to think about whether the vaccine is responsive to the particular virus, because these are all viruses and they can be slightly different. The topic of variants, you all have heard in the news with respect to COVID. So we're keeping an eye on Ebola, but it's not something we're as freaked out about as we were 5 years ago.
Interesting. There's a question here about where the current guidelines can be found, and I'm not sure. Joe, do you want to expand on what you're asking there?
Yeah, I'm a teacher and I am in schools, and I'm positive that whatever guidelines we started the year with are no longer, that they've learned things about it. Where can you find current information about about guidelines that have been changed?
Yeah, so cdc.gov is the site, Joe, but the school related guidelines have changed recently.
Yeah,
you're absolutely right. I mean, very recently. So
3 feet.
If you want to contact me, just by email, I can send you those guidelines. But cdc.gov is the main CDC website that has all of our guidance. I have to say, I don't know that it's the easiest guidance to find or follow or find, exactly. So, but there is a pretty good search function if you go to the cdc.gov website.
Okay.
Under COVID, and then you can search within that. But I'm also happy to find that for you.
So we are approaching 7:30. There are 2 more questions in the chat. We'll finish off with those. So Beth, how will international travel be changed from here on out?
Good question. So I don't know. I'm not any more knowledgeable about that than you all are. We did have conversations with the airlines over the past year. I know that Delta is still, I think up until this month anyway, not selling their middle seat, for example, which I think is a good practice. I think it's probably going to depend on how the vaccination process goes. There have been discussions about whether there should be a requirement that people show record documentation of vaccination before flying. None of that has been put in place at this point. So if I were you, I think we're officially not recommending travel yet, but I know that's not very practical, especially as people are vaccinated and want to go see their grandchildren and family members. So, I think looking for a time or an airline that has, like Delta, that is still not selling that middle seat, I think that can make some difference. And of course, you all know that the airplane itself is probably not as much of the problem as all the other stuff that is associated with being in an airport with lots of other people, being in the security line, all that sort of stuff. So anywhere where there's going to be a lot of people gathered together and you can't socially distance, and an airplane has pretty good ventilation. So it's not the plane itself, it's all the other stuff around it. So I think we should all still be very careful about flying until we have a little more vaccination percentage, maybe.
I did not know that airplanes were well ventilated.
They are, yeah.
Learned something new. So, okay, our last question for tonight is, do you ever think about how much systemic difference you make for all people?
I probably think more about not having enough systemic difference. So no, I never think that I am having systemic difference. I think that we hope we're making a little difference as an individual in chipping away at a public health problem like this. But really, it's the it's the people, it's the workers that are out there, and it's the responders dealing with the response. I mean, I hate to say it, just chokes me up, honestly, because I do think so many of these deaths were preventable. And, hopefully we have the leadership now in place to have better progress going forward. But, much of this really shouldn't have happened at all. And so we need to be better prepared, for the next one. There will be a next pandemic. And maybe if we can learn, some lessons learned from this one to not do this again, I think that would be an impact.
Thank you, Beth.
If I may, part of what Joe was asking and everything, there is a website, it's with the Ohio Department of Health, Responsible Restart Ohio. And they keep updating for schools and businesses and restaurant, various occupation sectors. And they keep updating what is the most current guidance. And Joe, I would look in there, Responsible Restart Ohio. About every few weeks, it's updated.
Thank you for that resource, Jane. And someone put in the chat that if you want to know more about plane safety, there was an episode on 1A yesterday about ventilation on planes. So look that up as well. So thank you all for coming out. Thank you, Beth, for sharing your expertise with us tonight.
Thank you
Thanks
all.
a lot, Beth.
Thank you, Beth.
Thank you.
Thanks.
Thanks.
That was really
Beth.
good.
Thanks, Beth.
Thanks, Beth.
Thank you.
Go get your wine.
Nice
Oh, it's
evening.
good to
Thanks,
see you
Beth.
back.
Thank you.